Welcome to the Health Science Coach Podcast. My name is Drew Garner. I am a health science and physical education teacher here at Turner High School. My objective is to provide information to students about different healthcare careers and explain how these professionals got to where they are in their careers. Thanks for spending some time with us today. Now let's dig in. Today we get the pleasure of meeting with Erika Murphy. She is a speech-language pathologist in Chicago. Welcome, Erika. How are you?
Good, I'm doing good. Thanks for having me.
Good. Well, hey, I wanted to get in touch with you and talk to you a little bit about your schooling and where you went to school, what your job was and what your job currently is going to be, and kind of go from there. So you studied at the University of Missouri, right, for your undergrad and your master's program.
Yes.
How did you choose MU kind of out of high school?
Sure. Yeah. So I know that can kind of be overwhelming as a junior, senior in high school when there's so many options. I was definitely kind of interested in going more towards a smaller school route initially. And when I sat down with my counselor, she was kind of like, what are your goals? Where do you see yourself going? And I told her, I wasn't sure what degree I wanted to pursue right away. I knew I wanted to go into a profession where I can help people. I kind of thought I wanted healthcare, but in what way, I wasn't sure. So I soon realized that if I wanted to go to a university to explore healthcare options, the larger universities are like a better option for that. Mizzou honestly had just a huge variety of options to explore. So that really caught my eye when she introduced that to me. And then also, so I grew up in Illinois. And so, being an out-of-state student, it does cost a little bit more. But Mizzou offered this like really easy in-state tuition program where you lived in Missouri for a year, made X amount of money, and then you were able to get that in-state tuition. So those two pieces there really enticed me to go. So that way I could use that freshman year to kind of explore what I wanted to do. I knew a lot of friends who, at that senior in high school, they're like, I'm going to be this, I'm going to do this program. But I was kind of just more willing to figure it out as I went. So. Yeah,
cool. So you studied at MU and you got your undergraduate in what degree?
Yeah, so at Mizzou, it was called Communication Sciences and Disorders. So basically, as like a sophomore in college, if that was the route you wanted to take, you applied for the undergraduate program. So your first 2 years, you did like a general education path, and then the second 2 years were a lot of core classes that you needed to have if you wanted to go to like a graduate program for speech-language pathology. So yeah, it was called like a Communication Sciences and Disorders program.
And then you worked straight through your master's there at MU as well, getting your master's in health science, speech-language pathology, like you said.
Yeah.
Did you go into that, or was there a delay in time?
Yeah, so there was, so I did, so right at my senior year, that's when you kind of are deciding. I was under the impression I was going to come closer to home. So I applied to like 5 graduate programs in Illinois, Chicagoland area. Mizzou was the one Missouri program I applied to. So you had to take like a GRE, and then you had to, submit kind of all of those, like how you would apply to college, but just as a graduate program. And then what really cemented me into staying was in undergrad I was in a research lab. I worked at a research lab. And that when I was offered a spot in the program, they also offered me like a graduate assistantship, which is like salaried basically as a student. And that could come as like tuition waiver, stipend for living, those sorts of things. And so that really, like financially, I was like, I have to do that. Graduate programs can be very costly. So.
So as a graduate research assistant, I have some experience doing that in exercise as well. What were some of the things or the studies that you did, or what did you work on when you were working as a GRA?
Yeah, so I really got into the lab because I was interested in speech-language pathology. I was more interested in the adult side of what we do, and specifically in dysphagia, which is like swallowing impairments, and that's something that speech-language pathologists can specialize in. So there was a researcher who was on our campus who was actually a speech-language pathologist, but also was a researcher in our vet school. Kind of interesting how those crossed, but I ended up in her lab, and we were studying. So she was very interested in adults who had dysphagia related to having ALS or amyotrophic lateral sclerosis. So I kind of worked with her on, she developed like a rodent model to study dysphagia in research animals who had ALS, if that makes sense. And then we studied some treatment options with that animal model.
Okay. Now, is that where your publication was from as well?
Yeah, so I worked on that project my senior year of college, and then we worked on writing that paper when I was in graduate school. So yeah.
That's pretty cool.
Yeah.
So was that a part of your thesis, or was that something different as well?
Yeah, so I used that publication, we developed that rodent model, and then I studied in my thesis a treatment option with that animal model as well. So it was definitely like a piggyback off that paper.
So for your master's program, you had, I'm assuming, 36 hours of credit to do after you went to undergrad, and then with some of those hours, your thesis option as well.
Yeah, so for our program, a thesis was optional, but in the lab I was placed in, it was, she had me do the thesis as kind of the requirement. But I knew a lot of students who did research that did not choose the thesis option. It wasn't required by any means. It was kind of just more of an additional piece to that.
Right, absolutely. What are some of the classes that you take, to get into speech language pathology as your undergraduate, and some more of the specialized ones as a graduate?
Yeah, so undergraduate, like I said, we had that program for the communication sciences and disorders. And so some of those were just like a general introduction to speech pathology to talk about in the profession what you could be working with. So you could be working with pediatrics on speech and language. You could be working with adults on social communication, cognitive communication, swallowing, all those sorts of things. So those were just more of like the general, this is what we do topics. And then some of the more specific classes I took in undergrad, I remember a pretty challenging one for me was phonetics, which is basically a written way of classifying some of those speech sounds that are helpful when we're giving diagnostics in the field to transcribe some of that spoken communication. Another one that I really liked in undergrad that I took was signed English. So I learned some sign language, which was neat, that I still use in my practice. And then we took like an audiology course, anatomy and physiology of the speech and language and hearing mechanism, neuroscience, just kind of some of those like general courses before you get into the more specific classes.
Yeah, cool. I also noticed that you were involved in quite a few different clubs and organizations. You have a outstanding poster in social and behavior science group, School of Health Professionals, interprofessional education committee member, multicultural certificate, impairment profile course completion, the Speak Out course completion, the Parkinson's Voice Project, and then also the vice president of National Student Speech Language Hearing Association. What do you think, as a now professional, what do you think those being involved in different clubs and organizations and groups has helped lead you to professionally now?
Yeah, so I knew kind of going, and this is going to go, I think, a little bit later on in our talk about something that, you wish you knew going into the, as high school, something you wish you knew as like younger. I was never very strong in my like standardized testing scores. So when it came to like taking the GRE, the ACT, I knew I kind of had to get really involved in other ways, which I think inevitably benefited me. So I really just sought out opportunities, whether that was work experience. I held at least 1 to 2 jobs, like all the time in undergrad. And then also some of those other leadership opportunities. I think those really helped like build interpersonal skills. So working with other individuals. I think also just being able to learn that like balance of, okay, I need to, spend this time an organization piece of studying and then going into work from this time and then going to class because everything is in person. So definitely taught that like organization piece that has been very helpful like later down the line. And yeah, in undergrad, we didn't really have clinicals. So I found jobs that kind of might have helped me. Well, I thought might help me. So I was a gymnast in high school. So I taught, I was like a competitive level gymnastics assistant coach in Jeff City for a semester. I worked at Easter Seals as an individual support assistant, so working with some kiddos with autism, like one-to-one support, research assistant as well. So just trying to, I guess, figure out like in what, like, I guess finding opportunities to work with others, because that's a lot of health professions, you're working with others, but also building some skills in that interpersonal, like getting to communicate with others, teaching, leadership, those sorts of things.
Right, absolutely. I think that all builds into, building your experiences and finding out what you like and what and so on. So you spent July of 19 to August of 21 at St. Louis Children's Hospital as a speech-language pathologist. What are some of the things that you did there, work-related?
Yeah. So like I said, really early on in my graduate degree, I was really adult focused. I wanted to work with adults in some sort of hospital-based position. We were given the opportunity to do full-time externships our second semester of our second year of graduate school. So what that means is we had like full-time internship experience Monday through Friday in some sort of setting related to speech-language pathology. So I did my first placement at a hospital in St. Louis with adults, and then my second was with pediatric patients at St. Louis Children's. I was in the cardiac ICU, and it was a very like eye-opening experience for me, and it really drove my passion for wanting to work with peds. But like I said, I didn't really know that going in. So it kind of switched my gears a lot, having that in-person full-time experience working with pediatrics. As when I was a student, I was getting ready to graduate, and one of the speech therapists was going to be transitioning jobs, so they had an opening. And we had to get, right after graduation, we have to do like a clinical fellowship year. And so they were, encouraged me to apply, and I was able to get that position at St. Louis Children's Hospital as a clinical fellow. So my day-to-day was, I was an outpatient speech-language therapist. And what that means is, patients would come in for appointments. So you'd come in every day and you would have, your schedule from 8 a.m. until 6 p.m. with all the different kids you were seeing. Some of the kids you saw on a weekly basis for ongoing treatment, and some of the kids were new evaluations that you would evaluate to see whether or not they would benefit from services. So I worked a lot with kiddos that had speech and language impairments, but I also specialized in feeding and swallowing, which in a way, went back to my thesis. I definitely had a passion for dysphagia. And so I incorporated that. About half of my caseload was feeding and swallowing, and half was developmental speech and language kids.
Okay, cool. Now, was that you said 8 to 6, is that a typical daily schedule for that type of position?
Yeah, so typically in an outpatient clinic, so I worked 4 10-hour days. So I worked Tuesday through Friday, and then I worked 10-hour days because a lot of kids would come after school. So those 4 and 5 o'clock spots were, important. But some places, might do Monday through Friday, and then 2 of the days you work until 6, and some of, it flexes. But typically you might see those longer days in an outpatient setting. Yeah.
Yeah, that's cool. So you did that for 2 years, and now you're getting ready to take on a new position.
Yeah.
Chicago Speech Therapy, starting next week.
I know.
Exciting for you to get a week break in there before you get back to work. Let's talk about what your new role is going to be and what that looks like for you.
Yeah, so just from what I have, heard about my new position, so there are a few different clinics for that Chicago speech therapy in a couple of areas downtown Chicago. So some of my therapy and evaluation services will take place in the clinic setting, and then some will take place in the home setting. So I'll actually be driving to some of those kiddos' homes to whether that's provide ongoing treatment or evaluation services. So it will be a little bit of a different setting for me, but I'm definitely excited to try that out and see how that looks.
That's cool. What are some of the things that you want to try to accomplish, after having 2 years of experience in the field? What are some things you want to try to accomplish, maybe new or different from your previous job to your new job?
Yeah. So I think my first 2 years, I was really just focused on like getting the skill set, building that skill set, getting comfortable in my own shoes, those sorts of things. But I'm definitely interested in taking on some more leadership roles. So that kind of specifically looks like I said, we had to do a clinical fellowship year. So becoming a mentor for some of those clinical fellows, potentially years down the road, maybe helping manage a clinic some days on my goals as well. So yeah, I think for me, taking on some more of those leadership roles are a professional goal of mine.
That'll be cool.
Yeah.
So you said, working into some of those leadership roles, you mentioned that you're going to be attending the SOS approach to feeding, and I'm going to mispronounce this, sequential oral sensory for SOS.
Yes, that was
Okay.
good.
And that's a convention in Dallas. What are some of the things that, speech language pathologists do for conventions and continuing education?
Yeah, so in order for us to keep our, we call them our Cs, but our certification to practice, essentially, we have to withhold a certain amount of hours of education. And so what that looks like is attending in-person conferences. Our professional organization, it's called ASHA, it's American Speech Language Hearing Association. You can also join like a learning path and do online courses on certain areas that you don't feel the most comfortable in, or you might be seeing a kiddo that you've never worked with that diagnosis before. So you're constantly learning as you go. But you could also, on the flip side of that, work on helping present. So I was actually supposed to be presenting with my hospital that I was working at in October on pediatric feeding and swallowing with some of my coworkers to help integrate that into more of the school outpatient clinic setting. So I think if you have a specialty or an area you feel confident in, you could also teach other professionals within that field that might not feel so confident in that area as well.
That's cool. So what's something that you're most proud of so far? Either it could be, from undergrad, graduate school, your first 2 years. What's something that really sticks out to you that, is a big accomplishment for you?
Yeah. So I feel like I in school wise, I feel like getting that graduate assistantship was a big feat for me, just because, like I said, I was told, along the way that my standardized tests weren't strong in those sorts of areas. So I never really thought that I had a chance. So getting that opportunity was a big accomplishment for me. And then within my professional area, I feel like getting my clinical fellowship in a hospital-based setting was pretty neat. Typically, when you go online as a clinic, when you're looking for employment, they say no clinical fellows accepted. So it was kind of cool to be able to get that experience so early on. I learned a lot from that as well.
Cool. Do you have anything that you regret not doing maybe in school, or, maybe you saw a job that you didn't apply for that you thought would have been cool to have, or something like that?
Yeah. So I feel like for me, this was one in school that I wish I had done. I wish I had done like a study abroad opportunity. I know that that's only offered for certain programs. I knew that for my program, if I did it, then I would have to, stay at school a little bit longer, and I would be behind on track a little bit. So I never did it, but I do know that a lot of students who did it loved it and learned a lot of just world knowledge and things that you don't get from reading a textbook or sitting in a lecture hall. So I would definitely encourage that if your students have the opportunity to do that.
Yeah, that'd be pretty cool. We talked a little bit about professional development. How many hours of professional development do you guys have to continue your certifications?
That's a great question. I think it is, so we do it every 3 years. I don't know the exact number, but yeah, every kind of course you take, it submits into a pool. I don't have that number off the top of my head, which I should, but I know it's coming up in a bit, so.
Yeah, we'll look that up for you.
Yeah.
Career goals, we kind of touched on it a little bit before, but maybe 5-10 years down the road, career professional goals, where do you see yourself?
Yeah, so I see myself, I think continuing on, still practicing as a speech language pathologist, but potentially helping, whether that's run a clinic someday or helping, a company kind of boost another clinic or helping out in some sort of leadership role is definitely a goal for me.
Absolutely. That sounds like a lot of fun too. I think
Yeah.
have your experience, and while you continue to build on what you're confident in, and then being able to teach the other people like you talked about and help them develop their skills is pretty important.
Right.
Looking at other than standardized testing, what is something you wish you would have known in high school or college that could help you with your career path now?
I feel like for me, I think that everyone's path is different. So whether, you have a goal and your friend has a similar goal, I think knowing that your way of getting there might look a little different than how someone else is. And just, it's good to talk to people and see, how did they get there, but also be getting comfortable in, it might look different and that's okay. And just enjoying that process too of learning and growing. I think another one is to staying open-minded, especially when you get to the higher level education. You might think, you have this idea in your head of, oh, this is what I'm going to do. This is the population I'm going to work with. And I think just you might have an opportunity that you're like, I'm not excited for this clinical, this externship or something. Just staying open-minded, because that might be something that you end up loving. So yeah.
That's pretty good. And then for somebody that might be interested in speech-language pathology as a high school student or early college student, do you have any books or articles that you might recommend that they check out?
Yeah, so one of my favorite books in graduate school that I read, it was called My Stroke of Insight by Jill Bolt-Taylor. It was a really eye-opening book for me. I think I read it maybe my freshman or sophomore year of college. It was about I think she was like a neuroanatomist that worked at Harvard University and was really well known in her field. And she ended up having a stroke pretty early on in life, probably in like her 30s. And so she's the author and she's the patient in this book, and talks about how she was, as much as she could remember, she lost her ability to walk, talk, write, recall events. And she talks about how she recovered after having this stroke, and the healthcare professionals that were part of her team in recovery, and the qualities that they had that were comforting during her recovery process, and some qualities that she was like, wow, this was really hindering in my process. So I think it was just a helpful, these are some aspects that are really important when you want to become a healthcare professional, because she's the author and she was the patient and she has all this neuroscience background. So it's a really neat read.
That's pretty interesting.
Yeah.
Kids look into that. Do you have a product or a tool, like, as a health teacher and PE teacher, we have equipment that we use throughout our day to help teach different stuff. What is some equipment that you have that helps you with your daily routines?
Yeah. So I feel like for me, I use a lot of articles and such from our professional association website, because I think a lot of the times you might have questions, and on that website you can ask people within the profession certain questions that they give you feedback and answers to. So I think that website and tool is like the most helpful, that I feel like if I'm ever stumped on something, that I am always going to for the most current literature, all those sorts of things, like new legislation that's getting passed within the field and those sorts of things.
Okay. Yeah, that's pretty neat.
Yeah.
So the next one is kind of a two-part question. It's if you like this and if you dislike this, then being a speech-language pathologist is not for you. So let's go ahead and start with the like of speech-language pathology. Yeah. So if you like blank, then being a speech-language pathologist is the right career path for you.
Yeah, so I think if you're really intrinsically motivated to help others, I think that's like a big quality, because that motivation on a daily basis to make a difference and be able to, whether you're working with peds or adults, be able to help out in any way, I think that's a huge quality. I think if you like learning and constantly developing your skill set, I think that is a big quality, because things are constantly changing in the field. No kid is the same, or no patient is the same. So I think getting comfortable with where to go if you have questions, and treating those patients, and that motivation to continue to learn and grow is also a big one too.
And if you dislike blank.
Yeah, I would say if you dislike working with people, if you more so like, if you're not really, I guess I like just being able to talk with others, and because you're working with a lot of other disciplines on a daily basis. So if you're more of someone who, doesn't really like that aspect of, or doesn't really see yourself doing that, I don't know necessarily if you'd really like being a speech pathologist.
Yeah, absolutely. And then this one was not on the notes I gave you, but I just kind of thought of it. You talked about being a peds speech-language pathologist and in the adult community. What are some of the, if you're not in with the pediatric patients, what are some of the other types of speech-language pathologists? Like, what do they do on a career path?
Sure. Yeah. So you could also, so my old roommate, she was an adult, or she works with adults, and she works in more of like skilled nursing facilities, assisted living facilities, memory care. So you can work a lot with cognitive communication and some of those aspects of, if you just had suffered from a stroke or some like dementia, those sorts of things, giving alternative ways of being able to facilitate memory and those sorts of things, working with adults. And a lot of the times too, adults, you work a lot with dysphagia as well, or swallowing impairment. So
okay, that's interesting.
Mm-hmm.
Last one is, do you have a quote or mantra that you kind of use to work off of or live by?
Yeah, so I feel like I touched on this a little bit, but in the part about what I wish I knew, but I like the quote, I create my own path and walk it with joy. So being comfortable in, you have a goal, your own path might look different, but just trying your best to enjoy it along the way. I know it can be scary, or and it can cause some anxiety not knowing the next step, but just trying to enjoy those steps, because looking back, yeah, it's a good journey, especially if you're passionate about it. So.
Well, thank you so much for spending 30 minutes with us talking about your passion. Really appreciate it.
Yeah, no problem.